Prostate cancer therapy has gone a complete sea change since the publishing of the ASCEND-RT trial, which is a scientific trial that was performed around 2 years ago. The thought on treating prostate cancer, as well as the different follow-up and so forth, has completely changed. That trial had scientists comparing 2 different types of treatment. The first type of treatment was the conventional radiation therapy, and the second type of treatment was that, but added this special kind of treatment called brachytherapy. Scientists followed these 2 groups of patients. These are men that volunteered to get this type of treatment, and they were randomized into one of these 2 different groups. And the scientists followed them for 10 years, and they looked to see how many of these patients would be free of cancer at the end of 10 years and how many would have cancer recur. At the end of 10 years, the patients in the conventional radiation therapy arm had a 65% cure rate, which is pretty good considering the fact that these men were intermediate and high risk patients, and that's a more aggressive kind of prostate cancer. However, in the patients that were in the brachytherapy group, they had a tremendous cancer cure rate of 85%. That is a full 20% higher than the patients in the conventional group, and that completely changed the landscape as far as how we think about giving treatments, because this particular style of treatment gives you a full 20% increase in the chance of cure. Brachytherapy is essentially, it's a fancy Greek word for being near therapy, and what that means is we take these tiny little radioactive seeds and we implant them into the prostate. They're implanted through little needles. This could be done awake, but typically we do it while the patient is asleep in order for them to be more comfortable. But there's no real recovery time because there's no cutting or scarring for this. But these tiny little seeds are implanted into the prostate, and when they're inside there, they're radioactive, which is with a special kind of radioactivity. That radioactivity only goes a very short distance, so it only affects the prostate in that near vicinity and doesn't really affect the rest of your body, so you don't lose your hair or get sick to your stomach or other things that people think about when they think about radioactivity. And it's only active for a short period of time, but during its activity, it has a tremendous ability to kill the cancer because it's located right there where the cancer is. The seeds are actually implanted right in the midst of the prostate, right in the middle of the cancer. And that's why you get that tremendous 20% survival improvement that was seen in that study. There's a large amount of expertise and experience that is required to be able to administer brachytherapy correctly and to be able to have the patient benefit most from that. And we're just very fortunate at our facility that we've been doing that therapy for over 15 years. The physicians that were originally at our facility had gotten together and said, this is the best treatment that we think patients can possibly get, and their intuition and their experience led them to that, and that has proven absolutely true based on the results of this most recent trial. So at our facility, we've been doing this for 15 years, and we have a pre-assembled team of very experienced people who are able to administer this brachytherapy procedure. And it's just tremendous to be able to tell patients when they come in that we're probably one of the few facilities in Georgia that administer this brachytherapy, and that we're able to provide that extra cure of 20% right here in your local community.